Hi, I'm Dr. Ko, a hair transplant surgeon in Korea. When patients come to me, this is the first thing they ask me: how many grafts do I need? But let me ask you this: would you rather have 2,000 grafts that grow perfectly, or 4,000 grafts, and half of them die? Here's something most clinics won't tell you. You have a limited number of follicles that can be safely harvested in your life. Let's say you're a healthy male with average donor density. You might have around 4,000 to 5,000 grafts total that we can use across your lifetime. That's your hair bank. That's it. Imagine your donor area like a bank account. Every graft we take is like a withdrawal. You can't just keep spending, or you'll go broke. And when that account hits zero, there are no bailouts, no refunds, just regret. Now, let's talk about engraftment rate. That's the percentage of grafts that actually survive and grow after surgery. High-quality clinics aim for 90% or more, but low-end clinics with poor technique or rushed work, you could lose 20%, 30%, or 50% of your grafts without even knowing. If the grafts are crushed, dried out, or stored improperly, they simply don't make it. Follicles are living tissue. Once extracted, they lose blood supply. Leave them out too long, they dehydrate and die. If clinics leave grafts on gauze for 2 to 3 hours, that's like leaving a fish out of water. Rough handling during extraction or placement can crush the base of the follicle. It might look fine now, but it won't grow. We store grafts in hypothermosol HTK solution at 4 degrees Celsius. This is the same preservation solution used in organ transplants, because if it is good enough for organ transplant, it is definitely good enough for hair transplant. Another mistake? Trying to cover everything in one session with low density everywhere. Of course, if you have enough donor hair, we can cover everywhere. But what if you're not? In that case, I'd rather give you 3,000 grafts placed strategically than 3,000 scattered like seeds on concrete. We prioritize frontal density because that's what frames your face. With 3,000 grafts, I can restore full frontal density and up to mid-scalp. In this case, the bald spot is not visible when viewed from the front by another person. However, if 3,000 hair follicles are scattered across the entire scalp for transplantation, your overall hair density will be low, making it look as if you have hair loss. Now, we do not want that, do we? So don't ask, how many grafts can I get? Ask, how many do I actually need to look natural for life? Don't chase the biggest number, chase the best plan. A smart transplant uses just enough grafts in the right places. That's how you win the hair game. If this video helped you rethink your strategy, hit like, and if you want more honest, no hype advice, subscribe. I'm Dr. Ko. See you in the next one.